Hi guys, my name is Claire Ucherike, and in today's video I'll be talking about ulcer. What is ulcer? Ulcer is simply an open sore, and specifically I'll be talking about stomach ulcer. Firstly, I will start with causes of this stomach ulcer. Smoking, alcohol, Helicobacter pylori, that's the bacteria implicated in ulcer. Chronic use of NSAIDs, all these can predispose one to ulcer. There's a long list of them, but these are the ones I just want to mention for the sake of this video. So basically in this video I'll be talking about lifestyle adjustments that can be very helpful if you have ulcer, because there's no point taking your meds and then you keep experiencing these symptoms. You know the symptoms you experience: the dull pain, the nausea, the vomiting, the heartburn. You can even have dark stools when one is already bleeding, and it's very important to know that ulcer can kill, especially when there's perforation and hemorrhage. So please don't joke with these lifestyle changes that can help you, and please share them with anyone who currently has ulcer. Sorry, I'm still thinking of malaria. Well, firstly, if you have ulcer, it's important to enjoy healthy meals. Healthy meals are basically your balanced diet, your veggies, your carbohydrates, your fruits, protein, fats. Enjoy them in the right proportion because it's very helpful, especially when you have ulcer. Secondly, reduce that weight. Weight loss is very helpful when you have ulcer. Thirdly, avoid smoking. Smoking, nicotine reduces the healing of the ulcer. That's the wound that is already on the lining of the stomach. So reduce that alcohol, reduce that smoking. It's not going to be helpful, especially when you already have ulcer. Fourthly, alcohol. Alcohol, when taken excessively, especially beer or wine, can irritate the lining of the stomach. So please reduce your alcohol or your wine intake. Avoid your trigger foods. That is the fifth point. Trigger foods like coffee, some people say beans, some people say spicy foods, citrus foods like oranges or tomatoes, fried foods, fried eggs. Some people will be like, when I have fried eggs, especially at night, I would have this dull pain that doesn't go away and it radiates. So please avoid your trigger foods. Sixth, eat small meals at particular times. So please don't starve. So this pain you may feel the pain more when you're hungry, and sometimes the pain can even make you not to want to eat, but just eat small meals at particular times. Don't overeat. Seventh point here is that you should avoid late meals. You should have your dinner, your evening meal 3 to 4 hours before bedtime. Eighth point is that you should elevate the head of your bed. Why should you do this? This elevation has a lot of benefits, but for the sake of this video, I'm talking about ulcer. It's important to elevate the head of your bed because it helps to keep the acid in the stomach down. The ninth point is that you should avoid excessive use of non-steroidal anti-inflammatory drugs. These drugs can affect the lining of the stomach, so chronic use of them can worsen ulcer. Finally, if you have psychological issues like stress, anxiety, depression, then they should be managed because they would simply exacerbate the symptoms of ulcer that you're already feeling. I hope this has added value to you. I hope you would share this video with your family and friends that are currently experiencing ulcer or have experienced ulcer in the past and feel like, okay, it has been managed and there's no need to adhere to these lifestyle changes. It's very important because it's just like going to open an old wound. It can be done. So please adhere to these lifestyle adjustments or lifestyle changes. Then the tip or the bonus points in this video is that there are some foods that are actually beneficial if you have ulcer. First, we have cabbage juice, we have garlic, turmeric, honey, aloe vera juice, probiotics. They have antibacterial activities that can be very helpful. That can be very helpful if you have ulcer. Thank you so much. See you in the next one. Bye.